What's going on, everybody? John here, and today we're going to be talking about ACL injuries, recovery options, and timelines. Unfortunately, this is something that's not going out of style anytime soon. We're going to be seeing more of them, so we figured why not talk to people about what the ACL is, how it's injured, and what the options are afterwards. Now, chances are this is something that's happened to you, a family member, a friend, a coworker, a teammate, whatever it might be. ACL injuries don't discriminate against age, gender, or activity type. In fact, we've seen ACL injuries on the rise over the past 2 decades, and it now accounts for a significant portion of overall knee injuries across the spectrum. When it comes to younger athletes, we see things like female basketball, female lacrosse, and female soccer being the highest risk factors for the females. But for the male counterparts, we'll see things like higher incidence of ACL injuries during sports like football, soccer, and lacrosse. Now, we're not going to talk about why this happens and the risk factors associated with it. That could be a completely different injury. But for the purposes of this video, I want to talk about what the ACL is, what it does in the body, how it can get injured, and then what the options are once it is injured. Ligaments are connective tissue that connects bone to bone. They help provide stability and make sure those bones don't actually move too far apart from one another. Your knee joint is where the bottom of your thigh bone meets the top of your shin bone. And the ACL, or anterior cruciate ligament, is one of 4 main ligaments that provide stability front, back, and side to side. In fact, specifically, the ACL is on the inside of the knee joint. It goes top to bottom, and it protects against excessive movement of your shin bone going too far forward relative to your thigh bone. Common mechanisms of injury for the ACL are hyperextension at the knee, a rotational force at the knee, or even some sort of deceleration with a bend at the knee. With hyperextension, it's often going to be from some type of landing where the foot gets planted and the knee goes extremely straight. With a rotational force, you're going to see these a lot with change of direction when somebody's trying to pivot or change direction, and you're going to get some sort of rotation or sideways bending at the knee. And with excessive flexion, you can often get this when somebody's trying to decelerate and get low, where their hips drop low. This is common in sports like basketball. When one of these things happens, the person may or may not know it. They may experience something like pain or a click or a pop, or they may experience nothing at all. They may have to stop whatever they're doing right away, or they may be able to continue participating for a short period of time. Regardless, when we are suspecting an injury to a major ligament like the ACL, we'll want to do a thorough clinical exam, but we'll also refer out for imaging. An MRI is a gold standard image for ruling in or out an injury to the ACL. Clinically, though, there are a number of tests that we can do for the knee to see what ligament is involved and to what extent. Now, like I said, ligaments prevent against excessive motion between bones. So, when we're looking at the ACL, we're going to do a couple of tests that will actually see if there's excessive motion between that thigh bone and the shin bone. Some of these may be painful, some of them may not be. Now, we're always going to compare to the other side, but regardless, a thorough clinical exam is very important when it comes to ruling in or out ACL injuries. The next step in the process is determining whether it's a partial or a complete injury to the ACL. A partial injury, just like it sounds, only some of the fibers are involved. The majority of it is still intact, has a good chance of healing, and has a good chance of providing the necessary stability moving forward. A complete injury to the ACL is usually where 75% or more of the fibers are involved, and you've lost a lot of structural integrity. The ACL can no longer do its job, and it's really not going to have a great chance of recovery. The exact location on the ACL, the extent of the injury on the ACL, and your chosen activity goals after the fact are probably the things that are going to help determine whether you're going to opt for non-surgical management or surgical repair of your ACL. Non-surgical management is usually reserved for people of a certain age who may not want to play competitive activity or sports anymore, or who may not think that the surgical risk is worth the outcome. It also is reserved for some people where the ACL injury and extent is in a favorable location for self-healing. Now, if you don't fit those criteria, your surgical team and sports medicine team are going to suggest a surgical repair. If you opt for the surgical route, the surgeon is going to help determine the timeline and also the type of repair. You may have the surgery right away, or you may wait a little while. You may have to do things like improve your range of motion, bending and straightening of the knee. You may have to reduce swelling. You may have to reduce pain, or they may want you to improve your strength a little bit. These things will greatly help benefit and increase the outcome of the procedure. While there are a number of different ACL repair options and graft options, we're going to save those for different videos. Today, we're just going to talk about the generic timeline after an ACL reconstruction. For full participation in contact, multi-directional explosive sports, you're looking about 9 to 12 months. You'll be doing activity well before then. In fact, things like running and heavy strength training, you'll probably be doing those things between 5 and 8 months post-op. But the full participation and return to sport is going to be saved for that 9 to 12 months. The reason why is because the study and literature has shown that if you return to sport at around 5 months post-op, you're looking at almost 100% re-injury rate. For every month that you wait after that 5-month mark, assuming you're doing the correct rehab, you're looking at a reduction of re-injury rate by almost 50%. So at 5 months, if you're looking at 100% re-injury rate, your re-injury rate drops to the single digits as far as risk goes during that 9 to 12 month period. Time alone isn't sufficient to help determine a safe return to activity. In fact, regardless of your activity, sport, age, or gender, we're very familiar with the needs of the knee, and there's a battery of tests and movements that we will have you do to help ensure that your knee and body can handle the demands of your activity. Success and perfection of these movements in the clinic helps minimize risk of injury and maximize your performance when you do get back to your full activity. Once you've demonstrated success with all of the physical demands, your sports medicine team should determine that you've had a successful rehab, and your surgeon will ultimately write off on a full return to activity. Your rehab and strengthening should not stop as soon as you're cleared to get back into sport. We've preached for years on continued training while athletes are in season playing, and this is doubly true for individuals that are coming off of ACL reconstruction. Now that we've covered a lot of the basics from how you injure your ACL all the way to how you get back to sport, let's recap. Your ACL is one of 4 main ligaments inside of the knee joint. They help connect the bottom of your thigh bone to the top of your shin bone. Your ACL specifically helps prevent your shin bone from going too far forward. But if you do injure it, where you injure the ACL and how much it's injured will help determine either you can go non-surgical or if you have to go for a surgical repair. If you have to go for a surgical repair, the process can take up to 12 months to return to full activity if you're going to be doing contact, explosive, multi-directional sports. You won't be left guessing how you're going to get back on the field. In fact, your strengthening and rehab routine is going to have a battery of tests that will help determine whether your body can handle everything that you're going to want it to do after the fact. And after you do get back to activity, you're going to continue that strengthening program for up to a couple years in order to make sure that you minimize your risk of injury to not only the already repaired ACL, but also the non-surgical ACL. I hope this was informative. If you guys have any questions, please feel free to reach out. Unfortunately, ACL injuries are not in short supply, and as always, the research and rehab and surgical repairs will continuously evolve. But moving forward from this, we'll hopefully do a few more videos breaking down the type of surgical repairs and also the non-surgical repair option. Hope you guys liked it. If you learned anything, please give us a thumbs up, give us a follow, and please ask any questions.